Hello, and how are you? My name is Winnie Barawa, and welcome to our session on components of school health program. If you're new here, this is a channel that focuses on lessons, lectures, and content pertaining to healthcare. And if that is your area of interest, please remember to subscribe so that you can be notified when we post our next lessons. So, if you've been following, we've been doing different aspects of school health, and we've checked so many things by now. You can refer to our previous videos on what we've been discussing. But again, please keep up because today we're gonna looking at the components that actually form the main work when it comes to a school health program. And so, before we go into more details, let's appreciate that the component models for the school health program vary based on the countries that you are, but most of these components originate from the main document, or that is from the World Education Forum or also from the World Health Organization guidelines. And these components, they can be in 8-component model, they can be in 5-component model, they can do the 3-component model, but the current one that is active is the 8-component model. And in the 8-component model, the school health program checks on 8 key areas that needs to be part and parcel of any school health program. And these 8 components vary from health services, health education, we have school health environment, nutrition services, physical education and activity, parent or community involvement, the staff wellness, counseling, psychological and social services. So in this session, this is what we are going to check on one by one and discuss them in details. So let's start with the first component, and that is on the health services, what it is and what it entails. So the first component is health services, and in health services, it includes any service that is given to students with the aim of appraising, protecting, or promoting health. So in the school health components, remember most of these components can be given broadly under the school umbrella, or they can be provided in a specialized unit that is in the school clinic. So with the services can be also provided by different specialties or different health promotion or health profession. And these services can vary from health screening. We can have control of communicable diseases. For example, in the days where we had coronavirus as a pandemic, there was need to control these diseases, and so there was need for masking while in school. There was need for social distancing in a bid of controlling these communicable diseases. Then there's immunizations. We have first aid. There's also administration of medications. There's special needs, healthcare planning, and also it can include issues such as daily nursing services. So this is an example of health services that can be given for children who are in school. And so remember, this is not just what is cast on stone. It can be as broadly provided as possible based on the school needs and what they require at that particular time. The second service is health education, and health education simply means providing information to the children. And so you can provide information, could be on physical education, mental health, emotional needs, and any social dimension of health. So the health education curriculum needs to be very comprehensive, and so to develop this, you can work together with partners to come up with this health education curriculum, but the main focus is at least providing information pertaining to the broad spectrum of the child needs, from physical to mental, emotional to also social dimensions. And so with the health education, you provide appropriate health information, and the main goal is to at least ensure it's promote informed health decisions, it promotes healthy lifestyles that can prevent the child from diseases. The health education is also supposed to ensure there is a behavior change that can end up enhancing school performance. So the agenda of health education is just ensuring there is proper health information to the child. And with the proper health information, then this child can make informed decision. This child can live healthy lifestyle that prevents diseases, and this child at the end of the day can attain the purpose of schooling, and that is enhancing school performance. And then the third component is the school health environment. And under school health environment, we are looking at the general surrounding that the child stays in as they go to school daily. So the general environment of this child could pertain physical environment, for example. And in this physical environment, we want an environment that is proper enough for the child to study and to attain optimal performance. So with the school environment and the physical environment, we ensure that the school provides proper building designs, proper lighting and ventilation, safety, a school environment that is clean, a school environment that is free from environmental hazards, hazards that can promote infection or handicap. We are looking at an environment that is safe, providing proper transportation, and an environment that has an emergency plan in place. So with the school health environment, you have to look at it, the different dimensions: physical, emotional, but also administrative. So that is by the physical environment, the building, the structures, the safety, the policies in regards to transport, emergency plans, and so on. But on the second environment that looks at policies and administration, this environment entails policies that are supposed to ensure there is proper health and reduction in stress. We want to look at policies and regulations that ensure the environment is free from drug abuse and weapons. We've seen cases where schools have been vandalized and children have been injured, and there's violence that has taken place and children have been handicapped or incapacitated. So the school environment needs to ensure there's policies and administrative um, channels that ensure that it's safe, free from stress, and regulations that ensure the students are free from drug abuse, weapons, or even violence. And lastly, the other environment is the psychosocial environment, and this is looking at supportive and nurturing atmosphere. And in here, we want to have a cooperative academic setting, an environment that respects individual differences, an environment that involves the community and families. So psychosocial is looking at a relationship angle where the child has a supportive academic environment that has cooperation between students and teachers, that has proper cooperation between teachers and the parents, or teachers and other community agents. And so with the school health environment as a component, the main agenda is to explore all the components of an environment, be it physical, be it administrative, or be it psychosocial, and harness all the characteristics that can ensure a child can have an optimal, healthy environment to study in. The fourth component is the nutrition services. And in our previous video on the school health team, we said that the nutritional services, majority of these services are checked in by the dietitian and the nutritionist. So through the work of the school health nutritionist and dietitians, the school provides nutritious meals, the school is able to ensure there's nutrition education, and the school is able to ensure that it is a nutrition promoting school. And with the nutrition services, this means the school is able to access a variety of nutritious and appealing meals, and it at the same time ensures that the meals accommodate the health and nutrition needs of all the students while ensuring that they are having a good learning experiences. Now, yes, the agenda is to have nutrition meals, balanced diet, and all that, but the school also needs to incorporate something we call nutrition related community services. And this is looking at activities like setting up school gardens, or bringing in nutrition awareness weeks, or nutrition awareness screening days, so that the child can be done checkups, they can be screened, and they can be checked if they're nutritionally healthy. So with the nutritional services, it has to be part and parcel of the components of the coordinated school health aspects. Fifth component is the physical education and services. And with this, the teachers or the school is able to teach aspects of knowledge and skills that are necessary for lifelong physical fitness. And majority of the physical education is enhanced through sports and games, because with sports and games, then the students can be provided for with physical education classes and physical education activities that can ensure the children are physically fit. The children can practice motor skills and also social and personal skills, because it is in this physical education that the children can interact, the children can meet with each other and exchange ideas. And for the main reason is to ensure that the child is physically fit, and some of the children pick these habits and they make them their lifelong activities. So as a result, physical education therefore becomes a lifelong necessary knowledge for them to ensure that they become physically fit. Sixth component is parent and community involvement. The school is not supposed to work independently, free from the community, but rather they need to consist and involve a wide range of the community stakeholders. And the stakeholders here, we are not looking at big organizations, or we are not looking at big international agencies. We are looking at any person or any individual who has a direct effect on the school. And this could include the parent, the educators, health and social service personnel, it can be insurance, it could be business or even political leaders. Now, the school works together with these particular stakeholders or any of these stakeholders to develop and form structures that can be tailored to meet the needs of the school in terms of health. So with the community involvement, the school is able to have a sit down, negotiate on the ideas that can be implemented and put into the comprehensive school health plan. They can be used to meet the community needs. They can mobilize for resources. They can also set standards that can guide on how to operate on the school health projects. So the parent and community involvement is key because it's a main channel of coming in together with the stakeholders. It's also a main channel of understanding the current development in the community and the upcoming needs that can be innovative enough to be involved in the community health plans. So this is very important because it shows that the school doesn't work alone, but the school can work in cohesion with the community to just pull together resources and ensure active participation from the stakeholders. And then we have the staff wellness. And with the staff wellness, the main agenda is to ensure that the school has met the health needs of the staff in order that the staff can become positive role models and increase commitment to the student health or to the student healthcare services. So with this agenda in mind, the school has been bestowed with the role of ensuring that it meets the staff members' wellness as much as the staff just work for the school. The school has to ensure that it provides avenues where the staff can be checked on, treated, or cured of any illnesses that they could be having. So for this purpose, the school can provide the staff with teachings, the school can provide counseling services, they can help the staff with monitoring of their health conditions, they can also work with promoting healthy activities for the school staff. We've seen schools like conducting capacity building sessions, conducting bonding activities with their school staff members, and when they go for these outings, they're able to see how far their fellow members are doing. They're able to actually understand the needs of their staff, and this is part and parcel of promoting staff wellness. It's just an avenue of ensuring that the staff can become open enough to discuss their health needs. The staff can become open enough and vulnerable enough to be checked on and be done screening for, be treated for, and be able to monitor their health conditions. And lastly, the last component of the school health is the counseling, social, and psychological services. So with these services, We are looking at promoting not only academic success, but the school needs to address the emotional and mental needs of their children. So most of these services are met by the psychologists and the counselors or the social health workers, but the main agenda is to ensure mental health stability and emotional stability for the children. So these services help in improving the health of the students and ensuring that the school environment is healthy enough to ensure that the students have their needs met. So these are components that are very key, and just like you can see on our diagram, these components are widespread from health education to health services, nutrition services, school health environment, family and community involvement, counseling, psychological and social services, and lastly, we have the health promotion for the staff. So looking at this continuum of care, it just tells you the children who are in the school or the school health program, as much as its agenda is to promote teaching and learning, it needs to encompass a composition of the various components that ensure optimum healthy living for the child, and it can vary around all this. Here are more references that one can check on or study on to get more knowledge on it. And so thank you so much for being with us to the end. Remember again to subscribe, comment, and share, and give our videos a thumb like if it's really been helpful to you. Till we meet again, bye bye. And my name is Winnie Barawa. See you.